My name is Ikechukwu Orji Uchechi. I am presenting on the topic that says prevalence of hypertension in relation to overweight and obesity among non-teaching staff of College of Medicine, University of Ibadan, Oyo State, Nigeria. Before I go on, I want to appreciate Texila for this kind opportunity to share this knowledge. It is an established fact that hypertension is a major public health problem, in sub-Saharan countries, particularly in Nigeria. And also, it is important to note that due to the level of detection, treatment, and control has been quite very low and is of great concern, suggesting that in the nearest future, some of the adverse effects like heart failure, stroke, and renal failures will become obvious in the years to come. And due to the symptomless nature of this disease, hypertension, in a given population, the people who are aware of their blood pressure is usually, they are usually very, very slow, very low. And as a result of this study was conducted to screen for hypertension, as well as determine blood pressure pattern among hospital-based workers. Then what is the problem? Why the hypertension? Particularly in Nigeria, in 1997, it was estimated that 4.3 million Nigerians above 15 years were hypertensive. Then another study conducted in 2010 also estimated that 20.8 million cases of hypertension in Nigeria among, age at least 20 years, with the prevalence of 28.0%. Then it is also estimated that by 2030, that the cases of hypertension among age 20 years will increase to 39.1 million, having the prevalence of 30.8%. That is, if nothing is being done concerning this. Among the work sites, a study conducted in the work site environment shows that there was 21% prevalence of hypertension, all conducted in Nigeria. Now, this study was able to address the following questions. Number one, the question on what is the prevalence of hypertension among this particular group of population where I studied. What is the prevalence of hypertension, as well as the prevalence of obesity and overweight among this group of people? Then, is there any relationship between gender and prevalence of hypertension among this particular group? And what has the prevalence of hypertension got to do? Does obesity contribute to it? These questions were addressed in this study. Study type was descriptive cross-sectional study, and the sample method was purposive sampling. 315 non-teaching staff was involved in the study, and validated semi-structured questionnaires were used to conduct data, and all the instruments, blood pressure instruments, height and weight were used to measure their blood pressure, their height, and their weight. Data analysis was done using SPSS. What's the results? These were the few social-demographic characteristics of the respondents. This few was selected because of its relevance to the study. It was discovered that in the study, most of the participants were majorly male than female, and they had good educational qualification. Most of them had tertiary education, and most were also married. The age group were mostly between 31 to. The prevalence of hypertension was this. The slides were so tiny that I'm not.
Fit to page.
Hello.
Fit to page.
Hello.
Fit to.
Can you see me?
Yeah, please. I can see you.
Hello.
I can see you.
Hello.
Hello.
Okay. Hello.
Hello.
Okay.
Okay.
Okay. Let me continue. Sorry for that. I said the prevalence of hypertension was 25.4%. That's the blood pressure of the non-teaching staff, as was discovered. The prevalence was 25.4%, and from the results we can see that the 1/4 of the non-teaching staff of College of Medicine who are working within the University College of University College Hospital are hypertensive, and it is in line with the study conducted in 2010. Although it was among the industrial population, but the prevalence was 26% in that study. The overweight and obese, it shows that the prevalence of overweight was 20.3% and 33.1%, and obese was 20.3%. Also, comparing sex, the gender, and the prevalence of hypertension, it was also discovered that male respondents were more hypertensive than the female respondent, with 68.8%. Then those within the age group of 31.4%, as in 31 years to 50 years, we are more hypertensive compared to those within 21 to 30 years. And from the result presented above, as we can see that the prevalence of hypertension is seen to increase with age, which is in agreement also with reports from several studies, and it was expected since the blood pressure tends to increase with advancing age. And also among the gender, comparing it within the gender, it is obvious that the male counterparts had more hypertensive than the female respondents. It is also in agreement with a study conducted in 2006. The lower prevalence, as was reported in 1993, could have resulted from the estrogen, which is a female hormone, which has been reported to have a regulatory effect on hypertension. And also there is a significant relationship between BMI and hypertension. A BMI of 25 correlates closely with increased blood pressure, and other studies also support that. Looking at the logistic regression, the result of multiple regression shows that body mass index and sex are correlates. Age, body mass index, and sex are correlates of hypertension. So respondents within the age group of 21 to 30 years and 31 to 40 years are 3 times and 2 times less likely to develop hypertension than those within the age group of 51 to 60 years. In other words, age group 31 to 40 years stands high risk of coming down with hypertension. They are closer to than those under the age of 21 to 30 years. In general, in this study, being overweight is associated with a 2 to 6-fold increase in the risk of developing hypertension. And also, clinical trials have proved that weight loss is effective in the primary prevention of hypertension. So weight loss has been recommended for the obese hypertensive patient and has been shown to be the most effective non-pharmacological treatment approach, according to Patel study. In conclusion, this study has once again highlighted the fact that hypertension is a problem in our society, even in the health environment. This is seen in the prevalence of hypertension we have mentioned earlier on, whereby 1 out of every 4 non-teaching staff is hypertensive. And also, overweight has been also significantly proven as one of the risk factors of hypertension. So it is quite disheartening that those considered being more prone to receiving health information and practicing such by virtue of their work environment, as well as their looming consequences rampant in the hospital where they work, are at high risk of this menace called hypertension. This leaves a question in the heart of many, that if the prevalence of hypertension, overweight, and obesity are high among people in learning and hospital environment, what is likely going to be the prevalence among rural communities where there is little or no health information of such? This calls for public health action to help workers of this category live up to expectation health-wise. I have to address the findings of this research, the following recommendations should be considered. Number 1, periodic departmental hypertension screening should be included in the hospital policy to help the staff working in the hospital environment, because it is assumed that these people, they have access to this information, or they can go at any time to check their blood pressure. But the problem, it is not as the public thing, because in the course of this study it was discovered that a driver in that environment, a non-teaching staff in that environment who drives and had a blood pressure of about I think 200 over 100, about that, did not even know that he was hypertensive until when we came to screen him. So such recommendation is necessary, such thing is necessary in the work environment. Also, live presentation of consequences and complications of overweight, obesity, and hypertension should be conducted monthly among the staff as a reinforcing factor for practicing healthy living. Periodic sports recreational program should be part of work schedule for staff working in the hospital environment, because most of them have sedentary life. They come to work in the morning and they sit down throughout, and at the end they dismiss by 4 or 5 and they go home, and the next day they come again without any activity, without exercise and all the rest. So it is recommended that sports or recreational program should be part of work schedule for staff working in the hospital.
Thank you very much for your
Thank you very
presentation,
much.
Ms. Mercy Uchechi. And here we go for the Q&A session. Dear participants, please raise a question. As well as Mercy, please share your email ID here so that everyone will contact you directly for the queries. Thank you, Ms. Uchechi. Now we are moving to the polling session due to time constraint. Dear participants, please vote for Ms. Mercy Uchechi for the presentation on prevalence of hypertension in relation to overweight and obesity among non-teaching staff of College of Medicine, University of Ibadan, Oyo State. Please poll for Ms. Mercy Uchechi.